This video is made for the management of suspected or confirmed COVID-19 patients in Advanced Pediatric Center PGIMER Chandigarh. In this video, we will see the doffing of personal protective equipments. After providing the patient care, the personal protective equipments need to be removed. The personal protective equipments are potential source of infection to healthcare workers. The doffing of personal protective equipments is a high risk activity and should be done in a meticulous way without any hurry. The requirements for doffing area are a trained observer or buddy, a separate room which should be different from donning area, a negative pressure room. If negative pressure room is not available, then put on the exhaust fan and switch off the ceiling fans, a dirty chair and a clean chair, a red line separating contaminated and clean areas, alcohol based hand rub in clean as well as in contaminated area, a full length mirror, reusable waste bin, disposable waste bin and wash basin for hand hygiene with soap and water. The trained observer need to wear full body gown, surgical mask, face shield, gloves and shoe cover. The trained observer will help and guide healthcare worker in safely doffing of the personal protective equipments step by step and discard it in appropriate waste bins. The trained observer will stand at a distance of 2 meters from healthcare worker. Before entering the doffing area from the patient care area, the healthcare worker must perform hand hygiene with outer gloves on. The first step of doffing is inspection of personal protective equipments. The healthcare worker should first turn around and observer visually inspect PPEs to see if there is any contamination, cuts or tears. If all right, the observer shout everything looked fine.
Everything looks fine.
If there are any obvious signs of contamination, disinfect with the wipes of recommended disinfectant. The next step is to remove outer gloves. Remove the outer gloves using glove in glove technique. Pinch the glove at wrist and peel it off and roll it inside out and keep it in other gloved hand. Now with the ungloved hand, insert one finger inside the glove of the other hand at wrist without touching the outer surface and roll it down from inside out over the first glove. Discard the gloves in disposable waste bin. Inspect the inner gloves and perform hand hygiene with alcohol based hand rub. The next step is to remove surgical gown. Untie the straps of surgical gown. And pull the surgical gown forward away from the body and remove it from top and roll it from inside out. Dispose it into disposable waste bin. Perform hand hygiene with alcohol based hand rub. The next step is to remove face shield. Remove the face shield while bending forward. Grab the head strap and pull it over the head. Avoid touching the front surface of the face shield and remove it away from the body. Place it in reusable waste bin. Perform hand hygiene with alcohol based hand rub. The next step is to remove surgical hood. Bend forward. Untie the straps of the hood. Grab the top of the hood and pull it forward over your head gently. Discard it in reusable waste bin. Perform hand hygiene with alcohol based hand rub. The next step is to remove leg covers. Sit comfortably over the dirty chair and remove leg covers by untying the straps. Dispose it in reusable waste bin. Perform hand hygiene with alcohol based hand rub. The next step is to remove full body hazmat suit. Unlock the buttons from below upwards. Trace the zipper from bottom up using one finger and hold and pull the zipper down to unzip. Get out of the full body suit holding the zipper edges at chest level. And remove it inside out in the order of top body, then sleeves, hips and legs. Pick the suit from the floor, touching only the inner aspect and not touching the external surfaces, and dispose it in reusable waste bin. Now perform hand hygiene over inner gloves with alcohol based hand rub. The next step is to remove disposable surgical cap. Discard the surgical cap in disposable waste bin. Perform hand hygiene with alcohol based hand rub. The next step is to remove the goggles. Hold the headband from behind and remove goggles without touching anterior surface. Discard it in reusable waste bin. Perform hand hygiene with alcohol based hand rub. The next step is to remove disposable shoe covers. For that, sit down on the clean chair in uncontaminated area outside the red line, but your feet still inside the red line in contaminated area. Carefully remove the shoe covers without touching the outer surface while leaving shoe covers inside the red line, and then place your feet with shoes outside the red line. Discard the disposable shoe covers in disposable waste bin. Now you are standing in clean area. Perform hand hygiene with alcohol based hand rub. The next step is to remove inner gloves. Remove the inner glove using glove in glove technique. Discard the gloves in disposable waste bin. Perform hand hygiene on bare hands with alcohol based hand rub. The next step is to wear a new pair of gloves. Perform hand hygiene with alcohol based hand rub. The next step is to remove N95 respirator. To remove N95 respirator, lean forward, grasp the bottom strap first and then top strap, and remove the N95 respirator without touching outer surface of the N95 respirator. Discard in disposable waste bin. Perform hand hygiene with alcohol based hand rub. The next step is to remove gloves. Remove the gloves as before using glove in glove technique and discard the gloves in disposable waste bin. Perform hand hygiene with alcohol based hand rub. The next step is to inspect surgical scrub. The observer will inspect the surgical scrub from front and behind to see if there are any visible contamination, cuts or tears. Now, doffing is complete and you can enter the shower area, remove your shoes and surgical scrub, take a shower and change to new clothes.